Hello, your child is a candidate for a research study conducted by the Pediatric Emergency Research Team at the Alberta Children's Hospital. This research study is part of a multi-city Canadian initiative to improve pediatric care. We truly appreciate your cooperation. Every patient entered in this study makes a difference and is important in our goal to improve the quality of healthcare for children in Alberta. The details of the study will be explained in this video by the research physician who is championing the study in Calgary. Dr. David Johnson is a pediatric researcher, clinician, and educator with 20 years of clinical experience, more than 100 published articles, and 20 research studies.
Azithromycin is a kind of antibiotic that's been used for many years and is known to be very safe. We know that most children who have wheezing episodes, that those episodes are triggered by viruses. And for that reason, we think that for the most part, antibiotics don't provide a benefit. However, in certain cases, we know that if children have sinus infections caused by bacteria, that can sometimes make asthma symptoms worse. In those cases, we would expect antibiotics, particularly azithromycin, because it covers the kinds of bacteria that occur in children with sinusitis, that would be beneficial. However, it's very difficult to know when a child has a sinus infection or not. There's no test that we can do that helps us know absolutely if one's there or not. So the purpose of this study is really to treat all children with azithromycin, the antibiotic, as compared with those who don't, to see if it makes an overall difference and improvement. This will be very important because we know that many physicians do treat with these kinds of medications like azithromycin routinely. It's important not to treat with antibiotics needlessly, because if you use antibiotics in cases where they're not needed, then bacteria gain resistance to those antibiotics and we don't have them when we most need them. So an important part of the study is to be very clear about whether or not kids gain any benefit from this, so we can ensure that we let all physicians know whether or not there's a benefit or not. If we find that it's not beneficial to all children, then we can significantly help reduce the number of kids who are treated with antibiotics needlessly. You nor the research assistant will know whether or not your child will be treated with azithromycin or a placebo. A placebo is a similar appearing syrup that is identical in a taste and smell and appearance to the actual drug, the medication. The reason for doing this is because it's very important for everyone involved not to be aware of whether or not they're actually being treated, because that allows us to know with certainty whether or not a medication is effective at treating a child with a certain kind of disease. There will be a 50-50 chance that your child will get antibiotics. Even though we won't be able to tell you at the time you get randomized, we can tell you after the fact whether or not that's true. And so you should let the research assistant know if you'd like to know in the future what your child was treated with. So in order to determine whether or not azithromycin is effective for children with wheezy symptoms, we'll evaluate it in 3 different ways. One is we'll see how long it takes for your child wheezing symptoms to go away. The second thing we'll do is to determine how long it takes for your child's wheezing symptoms to come back again. And we'll do that by following you over the next 6 months. The last way that we'll determine whether or not azithromycin is effective is by recording how often your child uses the quick-acting puffer, the Ventolin or salbutamol, and how many times your child's required to use that as your child starts to get better over the next few days to weeks. So the first thing that that will require you to do if you agree to having your child participate in this study, is the research assistant will ask you a series of questions about yourself and your child's disease. The second thing that will be required is for the research assistant to take a swab, a cotton swab, and put it into your child's nose. This won't hurt them, but they may find it a bit annoying. From this, we'll be able to test for what kind of viruses your child is infected with. The third thing that your child will be required to do is to take the study medication as administered by the research assistant or a nurse, and then as well you'll be required to administer the study medication to your child once a day for the next 4 days. The fourth thing that will be required of you is that once your child's discharged, we'll ask you to place the appropriate study sticker, which will be explained by the research assistant, onto a calendar that will be given to you. You'll need to do this every day. Essentially, it will allow us to know whether or not your child is improving, getting worse, or staying the same. In addition, the research assistant will give you a Ventolin puffer, that's a blue puffer, that you'll use as a quick reliever. This Ventolin meter dose inhaler will have on it an electronic counter that will measure exactly when you administer the Ventolin every day. A research assistant will contact you by telephone 4 days over the next 2 weeks. They will be on days 1, 3, 5, and 14. In addition to that, a research assistant will be contacting you once every 2 weeks for the next 6 months. Each of these phone calls will be very brief and can be scheduled at a time of your convenience. Approximately 3 weeks after you've been enrolled, we'll require you to come back to the Alberta Children's Hospital to be evaluated by a research nurse to see how your child is doing. This will take a brief time, approximately 10 to 15 minutes of your time. If your child develops asthma symptoms over the next 6 months, we'll also request that you give us permission to contact your family doctor or an emergency department, wherever you take your child, to be able to gather detailed information about how your child was treated. And last, we'll also examine your hospital records here in the emergency department, or if your child is admitted to hospital, to gather details about how your child was treated. The information that we gather on your child from involvement in this study will be kept private. The only people that will have access and know that your child's has participated in this study are the research assistant who's enrolling you now, myself as the principal investigator of the study, and potentially the ethics committee at the Faculty of Medicine at the University of Calgary. They are required to have access if something comes up that's important for them to review. Routinely, they don't do that. Otherwise, the detailed identifiers that would let anyone know that your child's participating in the studies will be taken out of our records, and so after that no one else can be aware or will be aware that your child has participated. Any information that's published in studies will be done in a consolidated form, an aggregate form, that will not allow your child to be identified as having participated in this study. Though your child won't necessarily gain any direct benefit for participating in the study, of course, studies of this kind provide a general great benefit to all children, because it allows us to know with certainty whether or not medications are helpful in terms of treating children with asthma. And that's a very important thing for us to know. The only way we can gain that information and know for sure whether or not these medications are effective are to do very careful studies that examine how a large number of children who've been treated do with their symptoms. Azithromycin can occasionally cause problems with vomiting and diarrhea, occasionally headaches. Very rarely it can cause a more serious allergic reaction. Very rarely, if your child is taking other kinds of medications, sometimes this can cause an unusual kind of heart rhythm. All of these more serious problems are known to be very rare, and we wouldn't expect them to occur with your child. In participating in this study, you nor your child will receive any monetary reimbursement other than for the expenses that stem from returning to the Alberta Children's Hospital 3 weeks after enrollment. We'll cover your parking costs for that, and then as well we'll give you a small gift card that will reimburse you in a sense for the time you've taken to participate in the study. This is a small amount, not a large amount. It's very important for you to know that this is completely your choice as to whether or not you participate in the study. If you choose not to participate, your care or your child's care won't be hindered in any way. So it's completely your choice as to whether or not you wish to volunteer to have your child enrolled in this study.
Thank you for watching this video. If you have additional questions about this study, please ask the study nurse who provided this video or contact our research department. At this time, we need your consent to enroll your child in this study. Please let the research nurse know when this video is completed and you have made a decision. Thanks again.